This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Paramedics use a strategic think first, stick smart approach based on several key factors. 1. Patient acuity. The oh no scenario, cardiac arrest, severe trauma shock. In a true emergency where the body is shutting down, blood vessels flatten out. Medics bypass the small, tricky veins and go straight for the biggest, most reliable targets. Usually the antecubital, AC, veins because they are massive and can handle rapid-fire fluid resuscitation. If those aren't available, they won't waste time fishing around. They'll pivot to an intraosseous, IO, line, which drills a needle directly into the bone marrow to act as an instant highway. The stable scenario. If a patient is stable, managing pain, mild dehydration, or nausea, medics prefer to start distal, further down the arm, like the hand or forearm, and work their way up. Saving the pristine AC veins for later prevents burning bridges if the patient needs a more invasive line or surgery later at the hospital. 2. The quality of the real estate. Medics assess a vein not just by seeing it, but by feeling it. Bounce and spring. A good vein feels spongy, bouncy, and squishy under the glove. A bad vein feels hard, rigid, or rolls away. Straightaways versus bends. Straight sections of a vein hold an IV catheter much better than a joint, like the wrist or elbow bend, which is why starting an IV above the wrist is usually preferred over the hand if the patient is going to be moving around a lot. 3. Medications and fluids being given. Some drugs are vesicants, meaning if they leak out of the vein and into the surrounding tissue, they can cause severe chemical irritation, tissue damage, or necrosis. For aggressive medications or thick blood products, medics need a large-gauge catheter in a robust, high-flow vein, like the AC or external jugular, rather than a tiny, fragile vein in the hand. 4. Transport and patient movement. If a patient is combative, seizing, or being jostled around in the back of a moving ambulance, a line placed in the hand or wrist is notoriously easy to blow or dislodge. Medics factor in how the patient will be handled during transport when picking an anchor spot. Potential complications to look out for. Starting and maintaining an IV line comes with a few common risks that medics monitor closely. Infiltration. This happens when the IV catheter slips out of the vein or punches right through the back wall of it. Instead of going into the bloodstream, the fluids or medications leak into the surrounding tissue. You'll notice the area swelling up, feeling cool to the touch, and starting to ache. Extravasation. This is the scarier version of infiltration. It happens when the fluid leaking into the tissue is a harsh medication that damages the skin cells. Medics have to stop the IV immediately and treat the area. Hematoma, the blown vein. If the vein ruptures while trying to place the line, blood leaks under the skin, creating a fast-forming bruise and a bump. It looks dramatic and hurts a bit, but it's mostly just a minor nuisance that means the paramedic has to apply pressure and try a different spot. Phlebitis, inflammation of the vein. This usually happens if an IV is left in too long or if the plastic catheter irritates the inner lining of the blood vessel. The skin along the vein tract gets red, warm, and tender. Air embolism, a rare but serious complication where a pocket of air gets trapped in the tubing and pushed into the circulatory system. Modern IV setups have safety mechanisms and strict protocols to prevent this entirely. Nerve damage or arterial puncture, especially in tricky areas like the inner wrist or the inner elbow near the basilic vein. An accidental nick of a nearby nerve can cause a sudden, sharp, electric shock-like pain shooting down the arm. If that happens, the paramedic immediately withdraws the needle. Hitting an artery, which pumps bright red, pulsating blood, also means pulling the line right away and holding firm pressure.